In this video, I will go over the lab presentations, clinical symptoms, as well as the treatment options for fibromyalgia, polymyalgia, polymyositis, and dermatomyositis. So fibromyalgia is a disease that is generally associated with depression. And these patients present with tender points. So generally, other than having depression and tender points, there is nothing wrong with them. And by tender points, I mean like on physical examination, you will find out that there are points that are tender on this patient. So like these are the tender points, also known as trigger points. So since there is no findings, like every lab is normal in these patients, you have to keep the test at minimal and treat these patients with either exercise program or antidepressants like TCA, SNRI, and SSRI. The next conditions, polymyalgia, polymyositis, and dermatomyositis. You can tell about their clinical symptoms from the name. So myalgia means muscle pain. So these patients present with muscle stiffness and muscle pain. And then polymyositis means inflammation of the muscle. So these patients present with muscle weakness. And then finally, we have dermatomyositis, which means that there are also skin manifestations along with muscle weakness. So there are muscle weakness along with the heliotrope rash, malar rash, as well as Guttron papules. Now for polymyalgia, only ESR is elevated, but the creatine kinase and the biopsy is normal. And generally, treatment for these patients is low-dose corticosteroids. However, you should also know that polymyalgia is associated sometimes with temporal arteritis, also known as giant cell arteritis. And these patients generally present with headache, jaw claudication, and pain in the temporal region. And also due to the thrombosis of the ophthalmic artery, these patients are at increased risk of blindness. So if polymyalgia is associated with temporal arteritis, then you will have to treat them with high-dose corticosteroids to decrease the risk of blindness in these individuals. The next condition, polymyositis, as I mentioned, is associated with muscle weakness due to the inflammation of the muscles, and there is elevated ESR and elevated creatine kinase for both polymyositis and dermatomyositis. In addition, both of these conditions are associated with anti-Jo1, anti-SRP, and anti-MI2 antibodies. And then important finding is that on biopsy of polymyositis, you will see endomysial inflammation, and it's associated with CD8 positive T cells, while the biopsy of dermatomyositis shows perimysial inflammation, and it's associated with CD4 positive T cells. And then the treatment for both polymyositis and dermatomyositis are high-dose corticosteroids. So next, I would like to go over the dermatologic features of dermatomyositis. So these patients present with Guttron papules that are shown right here, as well as heliotrope and malar rash. So next, I would like to show you the difference between malar and heliotrope rash. So malar rash is seen both in dermatomyositis as well as SLE. And if this is the face of a patient and here is the nose, with malar rash, it's a butterfly rash. So you will see a rash like this, like it's a butterfly rash that goes over the nose. While with the heliotrope rash, the rash is around the eye. So patients with dermatomyositis present with both heliotrope rash, shown right here, as well as the malar rash, which is a butterfly rash. And then on biopsy of the dermatomyositis, you see the perimysial inflammation that is associated with increased number of CD4 positive T cells. While in patient with polymyositis, you see the endomysial inflammation that is associated with increased number of CD8 positive T cells. So endomysial inflammation, there is inflammation inside the muscle fascicle, while with perimysial inflammation, inflammation is around the muscle fascicle and is associated with increased number of CD4 positive T cells. So the kind of mnemonics that I have here for you to always remember what kind of inflammation is associated with dermatomyositis. So derm should make you think of skin. And skin is always covering the surface. So these patients are associated with the kind of inflammation that is in the surface. So it's perimysial. While the endomysial inflammation, the other one, is associated with polymyositis. And then the second mnemonic that I have for you is that endomysial is associated with CD8. So CD8 positive T cells are associated with endomysial inflammation. So you can use these two mnemonics to remember the type of inflammation associated with these two conditions. And that concludes our discussion.